Hi, my name is Cynthia, and I decided to do my research project on epilepsy. So, epilepsy is referred to having a brain disorder that is characterized by seizures, and according to the CDC, seizures are considered a short change in normal brain activity. And as we kind of get into the later slides, we'll see that it's much more complicated than that and much more severe than that kind of definition gives off. And as you can see on the side, here's an example of a newborn who has, or just a normal EEG, and then when the newborn is having a seizure, so it's pretty traumatic on the brain. And the causes of this can either be genetic, post-traumatic brain injuries, can also trigger people to have seizures, or having a stroke can also trigger people to kind of have epilepsy for the rest of their life. So seizures are divided into two categories based on if there is the change in brain activity happening on the whole brain versus just one part of it. So a generalized seizure is when it's kind of affecting the whole brain versus a focal, which is just part of the brain. And then there's also subcategories between the two. So in terms of generalized seizures, they can either be absent or petit mal. Usually people use the word petit mal to describe these, and that's not as severe as the tonic-clonic one. This kind of just happens when people are staring off into space and rapidly blinking, so this could last a super long time. Somebody just isn't responding to you or even noticing you're there, and it could last for like a half hour. And a tonic-clonic, or also known as grand mal, is when somebody, this is usually what people kind of picture when they think of epilepsy, is when they fall to the ground and they're spasming and they're jerking around, and they tend to have like fatigue after the seizure, and that's because the whole time of the seizure they're actually flexing their muscles. So this could go on for like 5 to 10 minutes of just them flexing their muscles as hard as they can. So it's kind of like a workout for their muscles. And for focal seizures, again, it's only on one side of the brain, and it can either be simple, complex, or secondary generalized. Simple just involves some twitching or weird taste or sense of taste and smell. Complex could be feeling really confused and unable to answer simple questions, so somebody might not even know what you're saying when you're asking them questions. They can't even comprehend what you're even talking about, and that's usually a complex focal seizure. And secondary generalized just refers to when the seizure is first starting in one part of the brain and then it slowly moves outward to the whole side, or to whole two sides of the brain. So there's many reasons why epilepsy should be considered a public health concern, and just to name a few is that it can affect any age group. So like I stated before, people can get it right from birth and they can have them for the rest of their life. It's genetics, and sometimes that doesn't get expressed until later in their 20s, so you could just kind of have it all of a sudden. Also, it comes from post-traumatic brain injuries, so you could have something going on later in your life, and that also may trigger it, as well as having a stroke. So because there's such a wide variety about how you can get epilepsy, it's super important to address it. They also have a higher premature mortality rate, and they have a higher years of potential life lost. And there's also lingering effects of having epilepsy, so it can really affect your mental well-being, your physical, your relationships, your employment status, and things like that. There are also health disparities within people who have epilepsy, and there's also health disparities between people who have it versus people who don't. And I think there's not really enough training or preventative measures, and I think it needs to have more awareness, and that might help. And on this slide I also show that the epilepsy mortality rate has been increasing, so it is now 11.59 as of 2017. So as of right now, there's about 3 million adults and 470,000 children who have active epilepsy, and active epilepsy just refers to people who take medication for it. The highest cases are in California, Texas, Florida, and New York, as shown in the graph. That's probably because there's a higher population in those states. And there isn't a huge difference in the rate of people who get diagnosed with epilepsy between females and males. However, males have just a little bit higher cases, so it's 41 cases per 100,000 people for females, and then men, it's 49 per 100,000. So a few health disparities that I found to be the most important were that people with epilepsy tend to have a lower socioeconomic status, lower education, and higher rates of unemployment than compared to those who don't suffer with epilepsy. And one of the reasons I think this is because over 1/3 of adults with epilepsy are unable to work. So the reason for that may be because of the severity of their seizures, and the frequency of them can make it hard to have a job and keep employment. And so that kind of goes hand in hand, and this kind of stops them from being able to get the resources they need in order to treat epilepsy. Kids who also have epilepsy tend to have a lower academic performance, which again can kind of affect them as they get older. And African Americans are more likely to have higher hospitalization visits and more deaths after surgery than compared to white Americans. So sudden unexpected death in epilepsy is actually the second leading neurologic cause of total lost potential life years, and they follow after stroke. So this can also be really detrimental and can happen out of nowhere, either at a young age or if you've had it over time for a super long time and you have a seizure in a certain position, this could happen. And people with epilepsy are also found to have higher death rates by 27 times compared to a non-epileptic person. So these are just a few more health disparities that you kind of see with people who suffer from epilepsy. So with epilepsy, you're at an increased risk of getting in a driving accident, dying from a fall, asphyxiation, just because you could have a seizure at any of those moments and, fall down the stairs and hit your head, or, crash into somebody else when you're driving. And there's also a higher risk of losing employment, just because once the seizures happen over time and again, it gets more severe and you could not be able to work. There's also transportation issues, just because people with epilepsy tend to get their license taken away, at least temporarily, and it could usually be like 6 months or 12 months long. So being able to get from place to place might be a lot more difficult, especially if there's not really anybody else to help. So the cost of getting an Uber, or walking, or taking the bus. And there's also mental health issues that arise, just because it's really detrimental on your brain, so it can affect your mood and just how you feel physically overall. And people with epilepsy also tend to have higher rates of depression and things like that. So the biggest primary prevention method is avoiding head trauma, since we can't really stop someone from getting it genetically, just because it isn't because the mother was drinking too much or there was drugs or anything like that involved. Some people just have it in their family history, but avoiding head trauma, such as wearing a helmet and making sure that there's pedestrian-friendly roads where people can safely walk and ride their bikes, is important, just because head trauma is one of the biggest ways that people can develop epilepsy. And for older people, they're really at higher risk for having good or great falls, so making infrastructure that reduces that by having railings and elevators and things like that could really help that out and reduce the chance of older people from getting it. Secondary training is really important. It's more about education and training, so training nurses, teachers, and just about anybody about how to respond to a seizure in order to lessen the severity of it and maybe save their life. And having warning signs on videos, so some people have photosensitive epilepsy, so big flashing lights can really trigger that, so having this up before the video can help stop them from watching it and stop a seizure from happening. And also having doctors ensure that patients are using their drugs properly and taking them at the same time, and making sure they're taking it every day, because missing one pill can cause you to have a seizure. And some more personal responsibility has to do with avoiding sleep deprivation and alcohol and other things that may trigger an epilepsy, and just because those are the first two that usually people have a struggle with. So tertiary prevention is when the seizures are so severe that the doctor refers a lobotomy to happen, and there is actually a 20-year gap between having the diagnosis and the referral for it. Most people don't get it just because it's super scary, taking pieces out of your brain, but there is a success rate of 80% for those patients who are much easier and don't have it as severe. And This is because some people could be taking those drugs more than 1/3 and are still getting the seizures, so this is some type of like last resort. And yeah, that's all I have. Thank you.